Hello, it's Dr. Rhonda Johnson. Today is Monday, January 27th, 2025. And today, folks, I'm talking about cockroaches because they are a major public health nuisance. Now, they're not just unsightly pests. They're a major public health concern. They are found on every continent except for Antarctica, and cockroaches are built for survival. Did you know that they are incredibly resilient? That they can live a month without food, they can go 40 minutes without air, and 30 minutes underwater. They can move at speeds of 3 miles per hour, which in human terms is equivalent to a person running 100 miles per hour. Even baby cockroaches can run this fast within 2 days. They can live indoors and outdoors in both clean and filthy environments, as long as they have access to food, water, and shelter. Now, why are they a public health risk? Well, they can carry over 150 bacterial species, 90 different protozoa, 60 different types of fungi, and numerous parasitic worms. They can spread diseases like salmonella, Ecoli, leprosy, bubonic plague, and yes, even antibiotic-resistant infections. So let me talk a little bit more about antibiotic-resistant infections and cockroaches, because this is a major, the spread of antibiotic-resistant bacteria is a major public health threat. And cockroaches have been found to play a role in this because they transfer these resistant microorganisms between contaminated and uncontaminated areas through their bodies, their feces, and their vomit. This helps spread the acceleration of these antibiotic-resistant infections and makes treatment more difficult and further straining global health systems. So how do they spread disease? Well, it's mechanical transmission. The pathogens stick to their bodies as they crawl over contaminated surfaces, and then they spread them to other areas. They excrete and regurgitate their feces and their vomits, and they are full of these little harmful microorganisms that can contaminate our food, packaging, and surfaces. And then they are important sources of allergens. Their saliva, their feces, and they shed their exoskeletons, which can trigger asthma and allergic reactions, especially in children. So what can we do about this from a public health perspective? Well, we have to combat infestations with improved sanitation. We have to do things like seal entry points, eliminate moisture, and use professional pest control if needed. The takeaway message is cockroaches aren't just a nuisance, they're vectors of disease, and they are a growing challenge in the fight against antibiotic resistance. So if you have somebody that you know that has a cockroach problem, please share this message so that they maybe will try a little harder to get rid of these little pesky pests. That's my message today. Take care and be well.